Menopause is a natural stage in a woman's life. It marks the end of her menstrual cycles. A woman is considered to have reached menopause after going 12 consecutive months without a period. This transition occurs gradually. It typically happens between the ages of 45 and 55. During menopause, the ovaries produce less estrogen and progesterone. These are hormones that regulate the menstrual cycle. As hormone levels decline, women may experience a range of symptoms. These symptoms can vary in severity and duration. Menopause is a normal part of aging. It is not a disease. However, the symptoms of menopause can significantly impact a woman's quality of life. Understanding the causes, symptoms, and treatment options can help women navigate this transition with greater ease and confidence. It is important for women to educate themselves about menopause. Talking to their healthcare providers can address individual concerns and explore available management options. By proactively managing their health during this time, women can embrace the next chapter of their lives with vitality and well-being. There are three main types of menopause: natural menopause, premature menopause, and induced menopause. Natural menopause is the most common type. It occurs when the ovaries naturally begin to produce fewer hormones. This process typically starts in a woman's 40s and continues until menopause is reached. The average age of menopause in the United States is 51. Premature menopause occurs before the age of 40. This can be due to a variety of factors, including genetics, autoimmune disorders, or certain medical treatments. Premature menopause can be a challenging experience. It is important for women experiencing this to seek support and manage their symptoms effectively. Induced menopause occurs as a result of medical interventions, such as surgery to remove the ovaries or chemotherapy. These treatments can cause a sudden drop in hormone levels, leading to immediate menopause. Managing the symptoms of induced menopause is crucial for maintaining quality of life. The primary cause of menopause is the natural aging process. As women age, their ovaries gradually produce fewer hormones, eventually leading to the cessation of menstruation. This decline in hormone production is a natural biological process. While aging is the primary cause, certain factors can influence the onset of menopause. Genetics plays a role, as women with a family history of early menopause are more likely to experience it themselves. Lifestyle factors, such as smoking, can also contribute to earlier menopause. Menopause is diagnosed clinically based on a woman's symptoms and medical history. A doctor will typically ask about menstrual cycles, any menopausal symptoms experienced, and overall health. In some cases, blood tests may be conducted to measure hormone levels. These tests can help confirm menopause or rule out other underlying medical conditions. It's important for women to discuss any concerns or unusual symptoms with their doctor. This ensures accurate diagnosis and appropriate management of their health during this transitional phase. While menopause is a natural transition, the accompanying symptoms can significantly impact a woman's quality of life. Fortunately, various strategies can help manage these symptoms and improve overall well-being. Lifestyle modifications can play a significant role in managing menopausal symptoms. Maintaining a healthy weight through regular exercise and a balanced diet can alleviate symptoms. Engaging in stress-reducing activities, such as yoga or meditation, can also provide relief. Hormone replacement therapy, or HRT, is an effective treatment option for managing moderate to severe menopausal symptoms. HRT involves supplementing the body with estrogen and/or progesterone to restore hormone levels. HRT can effectively alleviate hot flashes, night sweats, and vaginal dryness. In addition to HRT, other medications can address specific menopausal symptoms. Low-dose antidepressants can help manage mood swings and irritability. Certain medications can also prevent bone loss, a common concern during menopause. Communication is key during menopause. Talking to partners, family, and friends about the experience can foster understanding and support. Joining support groups or seeking guidance from healthcare professionals can provide valuable information and resources. Remember, menopause is a natural transition, and with the right support and self-care, women can navigate this stage with confidence and grace.